Welcome everyone to this brief conversation on the use of artificial intelligence for global health in low and middle income countries. I'm Louise James from Accenture, and I'm really delighted to be joined here today by Dr. Anne Arts, head of the Novartis Foundation, but also the co-chair of the Digital Health Working Group for the Broadband Commission on Sustainable Development. I hope I got that right. That's quite
correct.
And it's brilliant to have you here today to talk about the work of the Commission and really just to share some of the early stage findings about both the opportunities and also the challenges for AI in global health in low and middle income countries. So if we think about the explosion of AI for global health in high income countries, we're seeing so many opportunities and so many diverse data sets, being able to leverage the use of wearables, such as IoT devices, so many exciting trends. But what are the trends where you see the most relevance for low and middle income countries?
The trends for low and middle income countries are pretty much the same, but the global health challenges we try to address currently are really unprecedented. Where before we were facing much more infectious diseases, for example, in low and middle income countries. Now you have this enormous burden of chronic diseases that have become the diseases of the poor, in fact. They are not limited to high income countries anymore. And unfortunately, health systems in low and middle income countries are insufficiently ready to address the needs of chronic patients, not in the least because there's an enormous shortage of healthcare personnel. If you look at the US, we have about 1 doctor in 300 population, more or less, where in Ethiopia, for example, there's only 1 doctor for 14,000 people. So the number of skilled health professionals is very unequally divided into the world. And that really compounds to the problem of getting access to quality healthcare for people living in low and middle income countries is really a big challenge now. So the whole global health landscape has changed, which means that we also have to change. And what is the better opportunity than the fact that we live in a digital era? We can really deliver health and care in the digital era and transform the way we do that, thanks to all the possibilities there are. And I think AI is really the most promising revolution we see that can transform or reimagine the way we deliver healthcare around the world, because it's going to address both the needs of chronic patients and acute patients in similar ways. We have beautiful solutions that work for those issues, and it can also address the shortage of healthcare personnel, because you have then possibilities to have people accessing virtual assistants, even if they live in very remote rural areas where there's no health workers at all.
So you mentioned there lots of, the opportunities and the need, right, for leveraging AI for global health. But we know that in many cases, actually, it is the low and middle income countries that can be left behind and not really be able to leverage these technologies. So what do you see as the risks of that actually happening?
That's such a good statement, because it's so true. The low and middle income countries are those that can benefit most from it, from the digital revolution and the AI revolution, but are also at the biggest risk of being left behind. And we have to work all together to make it happen that countries start to invest in the infrastructure for data and digital solutions, but not only in the infrastructure, also in the capabilities to use that infrastructure then and to use the data to build beautiful AI solutions. And for that, we have to call upon the leaders of the world, and let me do that here while we are at the World Economic Forum, to really invest in those things for countries. And within the report of the Broadband Commission Working Group on AI and Global Health, where we work together with Microsoft and Accenture, we will dig deeper into those challenges and opportunities. And we will bring like a perspective of what countries should do to move forwards on the ladder, to progress on that maturity curve and be ready to exploit the real potential of digital and AI.
And I know we've done promising. It is very promising, and I think it's always great to bring it to life with an example. And I know through the analysis we've done so far, we've been looking at lots of different case studies. What would be the one that you would pick out as something that really demonstrates the potential for AI in global health in low and middle income countries?
Yeah, the research we did with Accenture on all the use cases that are currently existing on AI in health is really extensive. But if you ask me for one example, the biggest one that comes to mind now is Ping An Good Doctor, for example. It's currently the largest medical digital app in China, and it already has 300 million users. In fact, it's an AI-powered platform that offers a very comprehensive solution. So every family in China that is a user of Ping An Good Doctor has access to a doctor, access to an electronic hospital record or health record, let me say it like that, and a health management plan. So it's a real comprehensive solution for people who have usually no access to healthcare. It's really changing the way we deliver health services around the world and improving lives for many, many people already.
Yeah. No, that's fantastic. And I think it's really important we showcase, right, these examples of what's working. But we were talking earlier about the fact that it's not all rosy as well, right? And we know that there are many challenges out there, whether that's around the data, the interoperability, around trust and privacy. What keeps you awake at night in terms of some of the challenges around leveraging AI in these contexts?
Leveraging AI in low-income settings is really challenging, true. And you mentioned almost all of the big challenges. But if I would pick one that really is, for me, currently the biggest one is the data. Because to develop and use AI solutions, you need mainly three things. You need good data, you need strong computational power, and you need algorithms. Well, the computational power and the algorithms, you can have them outside of the low-income setting. But the data has to be local. So we have to call upon countries to really build quality data that are interoperable and are not sitting into the silos, as is currently the case. We see in most of the countries where we work that data are siloed between hospitals, between primary healthcare systems, and they don't talk to each other. So you can never talk about coordinating care for one single patient, for example. It's very hard. So all of these issues are very important to be settled. The quality of data is another question. And we've seen also in our company Novartis to clean the data, even of clinical trials, very high quality data on itself, to make them interoperable and make them usable at large scale to build AI solutions. It takes a hell of a lot of work. So the quality of the data, the interoperability, and the accessibility to those data will be the biggest challenge for countries.
Yeah.
But I do think also that policy and regulation is a very big hurdle too for low and middle income countries. And of course, that's very vast as a topic. And it's really difficult for countries to strike the right balance between being strict enough in the regulations to protect patients and their families from privacy issues, but also not too strict to then stifle innovation. And that's a very difficult balance to strike.
And that's been a big topic of discussion this week in many of the sessions that I've been involved in.
True.
And I think the other one on the data side is the leave no one behind agenda,
Yes.
And we know that in these contexts, we have to also ask what data is it that we're not gathering and how can we access those populations. So one final question, based on the early stage findings of the working group, if there was one thing you would advise organizations to think differently about AI, what would it be?
One thing, well, I would say AI is not a hype. It's really real. It is there, it is achievable, and it is already impacting a lot of people's life. So there are fantastic use cases around that are available, that can be replicated in other geographies. It is real. Whether we like it or not, the innovation is there and is coming. So we have to have this call. So in our report, we really will stress that we aim to call upon governments to take the lead, to really decide what their vision will be, why they want to use AI. So what is the priority health problem in a country that they want to address with data, digital, and AI? And then build the ecosystem, the infrastructure that is needed around there, and the capabilities in their personnel, in their people, to use those solutions and to make them even better by learning from better quality data. So it is real.
It is real. It's beyond the hype, like we named it right.
Hype.
Well, Anne, it's been brilliant catching up with you today. Thank you so much. And I guess for those of you watching, just so you're aware, the Broadband Commission report will be coming out in the May-June timeframe.
Yes.
And as Anne articulated, it will have a combination of the research that's been done about the opportunities and the challenges, but also guidance, right, for implementers from different sectors as to how to move forward. So I would encourage you to go to the Broadband Commission website and look for that report in a couple of months. Thank you for watching.
Thank you.